Hello and welcome to this podcast presented by IQPC in conjunction with the Innovations in E-Health and Informatics Conference Europe. I'm your host, Helen Windsor, and today I'm joined by one of our speakers, Neal Mullen, who is the Group Deputy Director of ICT at St Vincent's Healthcare Group. Neal, welcome to the show. How are you today?
Very well, thank you.
Great of you to join us ahead of the event. Now, Neal, you mentioned in a previous conversation that St Vincent's is doing a pilot involving iPads. Could you elaborate on that? And how did you make the decision to run this project?
We have decided to look at iPads and iPhones as options to expand our healthcare data into the wider area within our organisation. The reasons for that would predominantly be the uptake in smart technology by users. So iPhones, iPads and other smart devices have become very, very popular, and clinical staff aren't any different to anyone else. They all have them. We saw the use of smartphones growing within our organisation. A couple of years ago we developed or expanded our wireless network to accommodate smart technology, personal smart technology, and the uptake on that was colossal, and it really went from there. So we saw when the iPad was released, we saw that as a real contender for developing applications onto it. So we're in the process of developing an application web portal. We have a number of users using iPads for access to clinical applications. And I think most of this came back to when we released email onto smartphones. Initially started off with corporate phones and then went on to personal phones. So if you look at the way we looked, or most organizations looked at security over the last couple of years, personal devices wouldn't be allowed. If it's portable, encrypted. So we sort of turned things around there. Obviously, corporate equipment is still encrypted, but we've developed ways of allowing users to use their own devices, smartphones, tablets, laptops, in a way that we don't have to manage their local security, AV protection. They're isolated away from other corporate equipment and corporate data, but they have access to our systems in a way that there is no interaction between their personal device and our systems that allows them to access our systems. So it's become very popular, and I think on a global level, E-Health and M-Health, connected health, are growing very, very rapidly, and we wanted to be part of that.
Yeah, it's excellent that you're advancing into this sphere so early on. And interestingly then, what successes and obstacles have you encountered?
The successes we've encountered is we suddenly have a new client base that we didn't really have before. We have a whole new range of clinical personnel that would have been maybe considered silent end users. They wouldn't have been heavily involved in the IT roadmap. And now we suddenly have this new customer base that is communicating better with us, working with us. The obstacles we've challenged was really around trying to prove that the technical solutions that we implemented were capable of doing what we were saying they were doing, and we had to go around security awareness education programs, getting external companies to validate our work to make sure that we were proving to people that what we're suggesting is going to work. And once we got over that, the uptake has been fantastic. We can't keep up with the demand.
Now, you'd mentioned the challenges presented by the evolving nature of data centres and how within the last 5 years or so they've all gone digital. What are some of those challenges, and are there any particular considerations that heads of e-health and informatics might traditionally overlook in your view?
Yeah, so I've been working in the technology section of healthcare for about 15, 16 years now, and the data center has changed, has evolved over the last few years. So going back 15 years ago, it would have been centralized systems with nothing on the desk, so it moved away from that to a single server for every application, and you had server sprawl 10 years ago, 8 years ago. And over the last 5 years, when things turned digital, from my own experience, we went from about a terabyte of production data 7 years ago, and we're probably close to 300 terabytes of production data now. So that creates an entirely new challenge. So our data center designs have to change to accommodate this condensed infrastructure. So we have two core data centers. One is 28 cabinets, or capacity for 28 cabinets, and the other is the capacity for 14 cabinets. So because of server sprawl 10 years ago, there would have been a low power usage and a low heat output per cabinet. With the condensed nature using blade technology, virtualization, SAN fabrics, SANs, condensed tape libraries, we're using more power and creating more heat in a smaller environment. So our data centers are reducing in size, so we're not using any more power. I'm not suggesting we're using any more power or we're not creating any more heat. What I'm saying is that in one cabinet, now we can use as much power and generate as much heat as the entire room did 5 or 6 years ago. So the design of the server room is obviously critical, that we're managing the airflow and power distribution correctly. But some of the challenges that people may be overlooking would be based around the disaster recovery and business continuity structures they have in place. So systems are far more integrated now. So in the same cabinet, we would have had 12 or 14 servers in it. Now we can have 300 or 400 servers in that same cabinet. So what we have to plan for and design that cabinet to maintain is completely different. Some of the other challenges that I think people often miss is the difference between disaster recovery and business continuity. So people often say, I have a good disaster recovery plan. And a disaster recovery plan is designed to get you over the first few hours of an outage. But in an extended outage, your business continuity plan is really what kicks in. How does your organization operate, and how does it continue to operate in the event of an outage? So recovery point objectives, recovery time objectives are core. Explaining that to key personnel, stakeholders, hospital management is obviously essential. That people understand that, you know, the recovery point objective of this is like 15 minutes ago, but it's going to take us 4 hours to get to that, you know, or whatever it is. And the shorter those time periods are, the more you need and the more it costs. So I think there are some of the challenges that people may or may not forget. Other things would be data growth and data deduplication. So if you look at a typical healthcare environment, it's built from silos of information. And over the last few years, those silos have become more integrated. But you still have replicate pieces of data in 5 or 6 locations, and it could be more. And as things went digital and become more uniformly digital, you will see that those pockets of information are growing. And you have 10 pockets of those pieces of information. There's no requirement for you to keep 10 copies. So deduplication would be another aspect. The backup design obviously changes completely. So if you have a file server 10 years ago or 5 years ago that was 100 gigs, you could have a file server now that's 2 terabytes and like 10 million files. So if you try to restore 10 million files, it's a completely different challenge that you would have faced a couple of years ago. And archiving. So archiving information that isn't critical. So managing the data processing from expensive fast disk all the way down to tape. So the archiving process of the data migration across expensive disk, less expensive disk onto tape, that's obviously vital. You don't want to have data that you don't need on very expensive disk. So they are some of the challenges that people may face.
And overall, moving on to another challenge, what have you found to be the greatest security challenge in the move towards implementing eHealth at St Vincent, and how are you combating that?
I think one of the biggest challenges is the ease of which people can develop their own solutions. And what I mean by that is the emergence of cloud computing, Dropbox type solutions, collaboration tools on the internet. So it's very easy now to set up a Google Docs account and share information with a number of your colleagues locally or on a national level. It's very easy to set up a virtual server or virtual environment on with Google, for example. I use a credit card number, and I think that's a big challenge for any organisation, and it's very difficult to manage that, especially when users are using their own devices to use it. So, the user comes into a corporate environment with their own device. It doesn't connect to the network. They have their own 3G access. It's very difficult to maintain that users don't develop these solutions themselves. So working with end users, working with clinical staff is obviously vital. Education, security awareness programs, identifying what are the users' requirements, and trying to explain to them and educate them that working with IT is better in the long run. The solution will be better in the long run. And that took some time, but over the last number of years, the awareness that we've spread out to end users has been fantastic. Users are coming to us now with data protection concerns and concerns about where the data is. 5 years ago, I've never heard of a user asking, is my data backed up? So the users are actually emailing us now, I'm going on holidays for 2 weeks, is my data backed up? And things like this. So I think working with end users and educating end users is the first aspect. When we look at moving into the e-health environment, one of, and not just our challenges, but one of, I think, the biggest challenges is identification. So without correctly identifying someone, giving them the correct level of authorization and authentication, no e-health solution will ever work. So obviously every patient in almost every hospital, I believe, has a unique identifier, but the staff often don't.
To move into this area then, I'm sure that you've had to specifically address fears relating to electronic data security and patient protection. Have patients or clinicians been particularly concerned or conversely particularly enthusiastic about this?
Initially, as I said, going back to the education and awareness types of programs, people didn't feel overly confident that their data was secure. We found a lot of users backing their data up themselves, storing it on CD-ROMs, this type of thing. So that's all changed over the last few years. What we do is we report back to heads of the departments with their availability, with the availability reports of their systems over the year. We also bring external companies in to validate our environment. So we have a 2-week security audit done every year. We bring an external company in and really let them go have a look on the entire network and see what they can find. And we report that back to people. We also provide users with updates ahead of the department's meetings, emails, newsletters, that type of thing. A lot of the work we did around reassuring people was more marketing than anything else. We had the technology in place, we had the procedures in place. We just had to let people know they were in place. So marketing wouldn't be an IT department's strong point. So we went on a marketing campaign about 3 or 4 years ago, and it's paid dividend for us now. People are more interested in data protection. Obviously, it's all over the news. Every day you're seeing 10 million records lost on a laptop here and so forth. So it's happening every day. It's in the news. People are seeing it at home on the news when they're having a dinner. So people are aware that if this does happen in our organisation, someone is going to hear about it and it's going to become tomorrow's news. So we have been successful in creating awareness, and I would think that people are particularly enthusiastic around ensuring that, first of all, patient data is treated sensitively, patient data is treated securely, and people are more understanding about how collaboration can improve services within their section or within their hospital. So it has been very positive over the last few years. I think people have become less IT afraid, maybe is the wrong word, and become far more aware of what technology can do. They're using it at home. You know, that they have Facebook, they have their own email accounts at home and so forth. They're seeing that what they can do, video conferencing. So it's fantastic to have that level of possibly an entrepreneurial spirit from people. You know, I have this idea, like if I do this with this person in this section, we're going to have this net benefit. And we actually have people coming to us with ideas, and it's fantastic to see healthcare being so innovative and creative. Would
you say that people's fears were actually genuine security issues, or were they more perception-based?
I think going back a couple of years ago, maybe 5 years ago, security wasn't on people's radar. It was more the big brother mentality. That someone's watching what I'm doing.
Yeah.
I think it was possibly more concern of, I don't want this guy in IT aware of what I'm doing. You know, I'm doing it myself. I know how to do it. I don't think it was more security. I don't think they're afraid of security. I don't think security in healthcare has really become prevalent, except for over the last maybe 3 years.
Yeah.
You know, many years ago, 5, 6, 10 years ago, it's not something that you would have heard in conversation with the average end user in a hospital. Security wouldn't have been a primary concern because they just weren't aware of it. And I'm not criticising them in any way, shape or form, but it just wasn't something that was out in the open, and now it is.
Yeah.
People are concerned about their own identity management, their own credit cards, what to do with their bills, what to do with their post. You know, that's just overflown into work. Some of the cases that you read about in the paper and see on the news, you know, a CD left on the train, a USB stick left there, and people are far more aware of it. And the media has done that. We've just jumped on the back of it and tried to market our own structure onto it.
Well, Neal, thanks very much for your thoughts on this topic, and we very much look forward to your presentation at the event. You'll be covering how to create best practices for worst-case scenarios, which sounds like a very interesting subject, and you'll be focusing on running damage control in case of data loss or theft. So we look forward to seeing you there in September. Thank you.
No problem. Thank you very much, Alan. Bye-bye.
Thanks. If you would like to attend the Innovations in E-Health and Informatics Europe conference, it will take place from September the 20th to the 22nd in London. For further information about the programme, please visit our website, www.ehealthinformatics.eu. Alternatively, you can contact our inquiries team on enquire@iqpc.co.uk or call 0800 652 2363.